hate to burst your bubble, but that online bunion splint is not going to permanently correct your bunion. And why is that? It does not address the true root cause, which is inherited poor biomechanics, foot type, possibly bony deformity, even though it advertises to correct the true root cause. It does not. Hey, I'm Dr. Gaffney, and as a podiatrist, I've treated thousands of bunions and have done hundreds of bunion surgeries. And I can tell you it's a very complicated deformity and there's no easy fix. The only way to cure it is to do a bunion surgery, and unfortunately, and I'm a very conservative doctor, so if there is a way to conservatively fix a problem, I would do it. Bunion splints may help very flexible early bunion deformities, but it is not going to permanently correct it. Once you stop using the splint, the bunion will come back, and I hate to tell you that. And at the end of this video, I'm going to share some alternatives to help with your bunion pain that are effective and more comfortable and less expensive. Bunions are so aggravating and painful. I can understand the desire for an easy solution can be very enticing. So clever advertising can prey on this and be misleading. That's one reason I started my YouTube channel, to help people sift through all the misinformation that's on the internet. So the next time you find yourself opening up your wallet to pay for an enticing foot care product on Instagram or Facebook, check its legitimacy first by asking ChatGPT. ChatGPT is so nice because it'll sift through all the scientific studies and condense it down to something that's digestible and easy to understand. So let's see what it says about scientific studies and evidence for bunion splints. Okay, we're in here in ChatGPT and asked it if there's any scientific evidence that bunion splints work, and what the evidence says. There's anecdotal evidence suggests that bunion splints may provide temporary relief from pain, primarily from redistributing pressure from the infected toe back into a normal position. There is little scientific evidence supporting the claim that bunion splints can significantly correct the deformity or reverse the structural changes of the bunion. There's limited studies. Biomechanical mechanisms. Bunion splints may work by temporarily stabilizing the joint and reducing the pressure. So these splints can help with joint pain while you're using them, and with flexible type of bunion deformities. And how do you know if your bunion deformity is flexible? Well, because your big toes move towards your second toe, try to move it to the straight position. If you can easily do that, then it's flexible. Also, the toenail should be straight up in the air and not turned to the side. So if you can easily straighten out your big toe, then it's flexible. Then a splint might help, as well as these other techniques I'm going to tell you about. If it's not straightening up and it's rigid, then you can still do things to offload the bump to help your pain, and I'll discuss that as well. So one thing you can do to offload the bump is just get an adhesive horseshoe felt pad or a U-pad and just put that around the bump. You can tape it on. That'll keep the shoe away from the bump, and any pressure on the bump will cause pain. Another thing you can do is find a stretchy toe box shoe, like a mesh upper and a cross trainer shoe that gives. Stay away from vinyl or leather. It'll press on it and hurt. You can even have your shoes stretched if you do have a vinyl or leather shoe. Sometimes ladies can get a men's sneaker, and men's sneakers are made on a wider last, so that'll give you more room too. If you have a flexible bunion, you can get a silicone hourglass spacer that'll push your big toe over. You can also get that silicone spacer attached to a silicone bunion shield, and it'll cushion the bump where it's less painful. I have a couple less expensive alternatives to the advertised online bunion splints. One is a Darco splint. This is a Velcro type splint, and I use this mainly to maintain correction after bunion surgery, and that's the most appropriate use of bunion splints, is maintaining correction until healed after bunion surgery. The other thing you can do is you can get stretchy tape like elastoplast, and that'll stretch and give, and you can use little gauze with it as well. So you can just loop that around your big toe and pull it over and put the gauze against the toe so you don't get that pressure type pain, and it cushions it. Warning here, if you're diabetic, poor circulation, have numb toes, do not loop anything around your toe, either a splint or tape because it can cut off the circulation to your toe. Even with healthy toes, anything going around it can cut off circulation, so check with your doctor before you start anything. Use these alternative realignment techniques, the Darco splint, the stretchy tape, and use it in 30 minutes to 2 hours like the fancy bunion splint that is advertised on Instagram and Facebook, and see how you fare. Other ways to help with the pain at the bump of the bunion, which gets inflamed, include biofreeze or Voltaren gel if you're not allergic, and always check with your doctor first before trying anything. Theoretically, an orthotic, which will control the foot motion, will help it function better and therefore decrease the formation of the bunion, and also to help with the true root cause of the formation of bunions, which is the poor biomechanics. You can get an orthotic, and the orthotic will help with the flattening out of the arch or the hypermobility, which is causing all the muscles and tendons to malfunction and causing the deformity in the forefoot as compensation. However, just like bunion splints, orthotics are not scientifically proven either. But anecdotally, I've seen it help many of my patients in my practice. Finally, if you're tired of dealing with your bunion, dealing with the splints, the pads, talk to your doctor about foot surgery. Nowadays, it's a lot less involved. You can get into your shoe quicker. You can get back on your feet quicker. Bunion surgery is the only thing that will cure your bunion permanently. Key is finding a qualified foot surgeon, either a podiatric surgeon or a foot and ankle trained orthopedic surgeon, and having the correct bunion surgery done. When it's done correctly in the proper procedure, the bunion should not recur. Thank you so much for watching. If I've given you some value, please like and subscribe, and we'll see you again next time. Here's to your best foot forward. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.